Hello, everybody. Thanks a lot to the organizers of UCL's Data for Policy Conference for inviting us, and thank you very much for watching this video and showing your interest into our work. We, that is myself, Markus Heemann from the University of Göttingen, together with Johann Pape from the World Bank Group, did research together leveraging household phone surveys from Kenya to monitor mobility-induced labor market consequences of the COVID-19 pandemic. During this video, we'll start with a brief overview of the COVID-19 situation in Kenya, continue with the precise research question together with our motivation. We'll spend quite a lot of time talking about the different data sources that we use, continue with the methods and our identification strategy, and finish off with the results. Let's start looking at the COVID situation in Kenya, and I'll provide you with a couple of statistics first. The first confirmed case of COVID-19 occurred on March 19, 2020 in the district of Nairobi. To date, more than 200,000 cases were confirmed with more than 4,000 deaths, and we can expect the true number to be much higher. Official recorded cases peaked on March 30th, 2021, with 1,354 confirmed cases that day. And as you can see from the chart at the bottom of the slide, there's currently a fourth wave underway, which is driven by the Delta variant. The government of Kenya was quite fast in responding to the pandemic and imposed multiple policies as early as January 2020, starting with first quite light measures on aiming at international air travel. But by March 27th of 2020, a nationwide curfew was imposed, and by April 6th, certain counties, among them Nairobi metropolitan area, but also Mombasa, Kwale and Kilifi, underwent a strict lockdown with movement in and out of those areas being strictly prohibited. The nationwide average mobility plummeted subsequently, and since April 2020 has been increasing again, as we can see on the next graph. What we have here, the red line, is the policy stringency index that we'll talk about more later on, but which pretty much puts an ordinal value to the different mobilities and their strictness that are in place, next to the development of different types of mobilities. And as you can see, for all those mobility types that are outside of residential areas, those plummeted in March quite significantly, and since then have been recovering. Obviously, the policies have been alleviated to some extent, but are still in place, many of them to this date. Taking this together, there seems to be a clear relationship between mobility patterns and policies that are imposed, particularly at the beginning of the pandemic. This has had significant impacts on labor market outcomes as well. As you can see on the slide, we graphed a couple of labor market outcomes with pre-pandemic levels compared to the very early post-pandemic levels in May and June 2020. We can see that unemployment rose quite a lot. Labor market participation declined quite a lot, with only 60% of people stating of being part of the labor force between May and June 2020. But the same is also observable for income earned within a 2 weeks period, both for the wage sector and agriculture, but also looking at the amount of hours worked, for example, in the wage sector, we see that significantly declined. Given these observations, we asked ourselves, how is mobility connected to those labor market impacts? So the overall question that we're trying to address really is the causal impact that the mobility recovery had on the recovery of labor market impacts over the course of the past year, so from May 2020 till June 2021. But next to that part, what we also want to look at is household-specific factors that are associated with self-reported reducing of mobility in Kenya. Obviously, self-reported data is always subject to certain bias. However, we believe that given that we have very large samples, it will still be informative to look at which factors seem to be determining whether people adhere to mobility restricting behavior or not. In terms of existing literature, obviously, quantifying labor market outcomes that are determined by mobility first of all, in general, but also following a pandemic, are very important insights for policymakers, because knowing about the economic consequences and their respective channels in a nationwide pandemic helps policymakers to identify precise target groups and implement the right alleviation measures for those most in need from early on. There's a couple of papers that deal with the questions, but also data that we use. The most notably, I want to mention Markus et al. That took a look at the economic and social impacts of human mobility restrictions in Italy, where their methodology deviates from ours, is that they took mobility as a proxy for economic downturn. We keep them separate, and we specifically will focus on how mobility impacts economic activity, specifically labor market outcomes. Kamis et al. Did a lot of work on the early labor market impacts of COVID-19 in Kenya, but also in 38 other countries. Saha et al. Was able to show that Google mobility data, the community reports, are a useful tool to show successes in mobility restricting policies. And there's a lot of other papers, obviously, dealing around COVID impacts. However, none, to the best of our knowledge so far, has taken a look at causal impacts of mobility restriction on labor market recoveries. Many more papers have taken a look at different factors that determine whether people adhere to mobility restricting behavior or not. There's a lot of literature. However, what we found is that most of the literature either is in a developed country setting, taking data from Italy, from the US, so countries that very early on also had high cases of COVID. Or the other issue, for those studies that took place in a developing country, often sample sizes were very, very small, or were an online-only sample, clearly excluding large parts of the population. We believe that with a large data set that we have, we are able to come up with much more, first of all, credible insights, but also given the wide range of different covariates that we can test for, we believe that, for example, with additional dimensions of trust, we can add new aspects to the existing literature. There's three main data sets that we use for our analysis. The first is Google Community Mobility Reports, which plots mobility changes for different types of locations, as we saw earlier on the chart, compared to pre-COVID levels. The second data source is the Policy Stringency Index, which is an ordinal index quantifying mobility restrictions, policy stringency on national level. And it also includes data on the daily confirmed total cases that we had in Kenya. Finally, we include, and that's probably the most important data set for us, the Kenyan Rapid Response Household Surveys, which are high-frequency panel surveys that were conducted over the phone, asking about a number of different topics, such as knowledge about COVID, employment, income, food security, but also the perception of the government's response. Taking a look at Google mobility data first, the COVID-19 community mobility reports aggregate and anonymize changes in mobilities from smartphone users with Android systems that turn on their location history settings. The data displays visits to or time spent in 6 different categories: residential, grocery, pharma, transit, workplaces, retail and recreation, as well as parks and leisures. The latter we will exclude. Data is recorded and collected on national and county level, which helps our county-specific analysis. And the changes are compared to baseline value, which comes from a 5-week period prior to the pandemic, where we compare weekday-specific changes. Taking the first 5 categories, we construct an average weekly change in mobility index that is then later on used in our analysis. The next data set that we use is the COVID-19 government response tracker. The tracker tracks health policies, economic policies, but also containment and closure policies of governments during the COVID-19 pandemic. Individual policies are recorded, given an ordinal value, and depending on severity and magnitude, scores are aggregated into indices, taking on values between 0 and 100. And we'll take a look at the policy stringency index, which bundles all containment and closure policies enacted by the government of Kenya. With that, I'll be handing over to my colleague Utz, who will walk you through the rapid response phone survey data, as he was quite heavily involved in the collection of this.
Thank you, Markus. So now I will quickly introduce the data source of the rapid response phone survey, and then start with the methodology before I'm going to give it back to Markus to walk us through the results. So the rapid response phone survey in Kenya is actually a panel survey, and we had started this in May 2020 and then proceeded with like 5 waves until June 2021. And in fact, we are also planning a 6th and a 7th wave at the moment. The sampling frame consists from two different sources. The first one is from a baseline survey where we collected phone numbers, but this happened already quite a number of years ago. And so therefore, we supplemented the sampling frame with a random digit dialing component to make sure that also households that did not have a phone number at that time are also included in the sample. Of course, we do use some reweighting techniques to make sure that then the resulting sample is representative of the population as much as possible. And of course, we can only capture households that actually have a phone, because otherwise we cannot reach them. The survey itself, the questionnaire, is very comprehensive and covers a couple of different topics, and you can see them on the slide. Of course, the impact of COVID-19 in terms of like labor markets, but also changes in behavior, also perception questions, and also food security questions. Here's just sort of like some descriptive statistics from the survey, and you can see the 5 different waves, and you can see that actually the sample itself is quite similar across the different waves, which is quite comforting. You can also see the sample size ranges from 4,000 to almost 6,000, depending on the wave. And of course, also like the response rates varied a little bit. And you can see that the fraction of the random digit dialing is about 20% across the different waves. Here, I show the same graph as at the beginning, which shows you the trajectory of the mobility restrictions in Kenya over time. And you can also see that we've marked the different waves across the different time points when we've implemented them. And you can see that they actually spread quite nicely across the whole period of the pandemic so far. And you can even like see that some of the waves capture certain moments, for example, with increased or lifted mobility restrictions quite well. And this, of course, is quite helpful for the analysis later. So here we have one slide on the methodology. What we are using is an instrumental variable approach, because we are interested in understanding the causal impact of mobility changes on socioeconomic variables like, for example, labor market outcomes. And so for that, we use as an instrumental variable the policy stringency index, and we assume that it has been enacted externally, but we do control for the change in the number of cases. And of course, that's sort of like the crucial assumption of the identification, that the policy stringency index did not affect the outcome variables in any other way than mitigated through the mobility changes. And of course, the case numbers as we control for those. And so this, of course, gives us already then the first stage, where we see as a dependent variable the mobility, and then as independent variables, we've got the policy stringency index as well as the change in the number of cases. This, of course, then also leads us directly to the second stage. In the second stage, we have as dependent variables, different outcome variables denoted as Y, and these are, for example, the employment indicators. And then on the right-hand side of the regression, we have the first stage, and then we also control for certain household characteristics denoted as X, and you can see them on the slide, for example, economic uncertainty, fear of illness, and so on. And we, of course, also throw in the change in the number of cases. And then finally, we also add county fixed effects, so that we only look at the variation within counties, which of course gives us a more powerful identification. And now I give it back to Markus to walk us through the results. Thank you.
Thank you very much, Utz. With that, let's take a look at the results that we got, first of all, for the causal analysis of mobility's impact on economic labor market indicators recovery. So if we take a look at the first stage, indeed, we find that both policy stringency index and weekly change of confirmed COVID cases significantly are correlated with the average change in mobility with the right sign as well. Interestingly, the policy stringency index has a much higher coefficient by a factor of roughly 8 compared to the weekly change in confirmed COVID cases. So indeed, it seems to us that we do have a valid instrument that we can use for the further analyses. On this table, you see 4 different columns, and I want to focus on the second column first, the instrumental variable analysis with our full sample. Interestingly, the most significant effects we find for our extensive margins of employment. First of all, the status of either being employed, unemployed, or not part of the labor force. And it seems to us that the recovery of mobility has had a causal effect of people returning into the labor force, most of them returning into employment. Looking at the hours worked in the past 7 days, we see a significant effect on wage jobs, and we still have a 10% statistical significance for agriculture hours. But if you take a look at the coefficient, also much lower than compared to the impact on wage job recovery in terms of hours worked. And we do have a 10% significance on the amount of income generated by wages. So it seems that even though we have an increase in hours again, it didn't that much impact the amount of income in the wage sector, both formal and informal. Now, taking a look at urban versus rural, we see that interestingly for the extensive margins of employment, the coefficients are nearly the same, so very, very similar results. However, differences arise when we take a look at the hours worked or the income generated. What we find is that the impact on wage jobs in the rural setting were much higher compared to the urban one. However, looking at agricultural hours and also income made, we find significant effects on the urban side that do not take place on the rural side. Now, there's a couple of reasons for this. For example, it could be that in the rural setting, agricultural work is closely connected to where people actually reside, so that by staying at home, they can still work in the agricultural setting. Why this is more difficult in an urban area. At the same time, with more prevalence of wage jobs in an urban area, it may be that due to COVID, the effects are much stronger in a rural setting for wage jobs. If we take a look at the other covariates, what we just saw was plainly the causal effect of mobility on labor market outcomes. We find interesting, significant associations. And I think most notably, what is interesting is that age was positively associated with an increase in employment and negatively associated with re-entering into unemployment, clearly showing that people with more age, with probably more work experience, found it much easier to re-enter into employment compared to probably younger, less experienced parts of the society. Taking all this together, we find that overall mobility recovery most significantly influenced re-entering into the labor force and had overall more impact on the wage sector, both formal and informal, than agriculture or self-employment. In urban areas, agriculture recovered significantly, pointing to the fact that mobility disruptions caused more initial declines. And at the same time, age was positively associated with re-entering the labor force with employment. Taking a look at the other analyses, the household-specific factors that are associated with self-reported reducing of mobility in Kenya, we ran regular OLS regressions and did the similar analysis for both the full national sample, but also for rural and urban. And interestingly enough, for the national sample, only 3 factors really stood out to be statistically significant. One is trust in government, the other is employment status, and the third is the overall policy stringency level. Interestingly, trust in government is negatively associated, hinting to people's tendency to feel less pressure to adhere to mobility restricting behavior themselves if they believe that the government does a good job in handling the pandemic overall. Employment status, on the other hand, is positively associated, which may be due to the fact that people who are in employment face higher opportunity costs of getting infected. At the same time, policy stringency index is significantly correlated, which implies that the more strict the policies are in place, the more people feel inclined to actually reduce their own mobility and social interactions, which really hints to the signaling effect of very strict measures to ensuring adherence. Looking at rural versus urban, in a rural setting, this trust in government does not seem to play a role. However, employment seems to be a much stronger determinant regarding do I comply or do I not comply. Policy stringency index similarly in terms of magnitude and significance. On the urban side, however, we see that really trust in government there seems to play a role. Education level as well, the more educated at least self-report that they also do comply. Household head status is also positively associated with complying to regulations or reducing own mobility, as well as is knowing someone who was infected, which may point to the fact that in an urban setting, either the risk awareness of knowing someone who's infected and the high risk of the pandemic through population density is something that that people think about, or maybe the fact that they know someone gives them the feeling that they themselves may carry the virus, and because of that reduce their own mobility and social interactions. Similarly, policy stringency index is quite high and significant. Now, comparing magnitudes, policy stringency index, the coefficient refers to a 1-point increase in stringency level. In Kenya, we've seen stringency index levels from 0 to 88.9. So a 10% or a 10-point increase in policy stringency already gives us, if we take the national level, a 0.6 effect on adhering to the to self-restriction of mobility, which is much higher than the other relevant coefficients. So policy stringency index really seems to be an important factor here. Summarizing the key takeaways, trust in government had a negative effect, pointing to the notion that if government is able, I do not need to comply. Employment status had a positive effect. My risk of getting infected and losing job is higher in a rural area. Higher policy stringency levels had large positive effects in all areas, and in an urban setting, education level, household status, but also knowing someone who was infected seems to play a role. Bringing all of this together, there's three key takeaways that we have. First of all, reducing mobility and allowing mobility to rise again impacts different groups and economic sectors differently, stressing the importance of proper target group identification and mitigation measures to contain the economic costs of saving lives. The second point is that measures aimed at reducing mobility need to be accompanied with proper communication channels, but also messaging, depending on who the target group is and what might be their determinants in order to comply with self-reducing mobility. And finally, high-frequency phone surveys can be a powerful tool to attain representative data to analyze socioeconomic activity and household behavior during the course of a pandemic to tailor targeted interventions that really reach those that are in need at a specific time, at a specific place. With that, we would like to thank you for your attention and look forward to the discussions we'll have during the conference in September. Thank you very much.